Dr. Frank, can you talk about, and we're all hoping for a miracle here for Damar Hamlin, but you talked about the oxygen. His brain may be deprived of oxygen for, we know, several minutes, possibly 9 minutes. That's how long they perform CPR on the field. What does that mean for any patient?
Well, the seconds count in these situations. And now we've heard stories of children fall under the ice and they could be in cold temperatures and they've made full recoveries after 20, 30 minutes at times. But number one, this is with very young children that have high brain plasticity, meaning that their brains are more likely to recover. He's a little bit older, but still fairly young. I have heard reports that they might have used this sort of cold therapy for Damar, that's the standard of care now in ICUs. And I believe that this hospital should be equipped for that, where as soon as they get him in there, they lower his body temperature to allow the brain to heal and to give him a chance to recover. So hopefully all these things are going on. He's certainly in the right place.
Hopefully he does begin to breathe on his own. What type of tests will they do once that happens? Because I know they can't do as many tests now while he's on that ventilator.
Right. So what you typically do when someone's on a ventilator, they'd be intubated and sedated, because obviously it's very uncomfortable to have a breathing tube in place. So when you have somebody on a ventilator, they're typically under sedation. What you would do is reduce that level of sedation slowly and see and then reduce the amount of oxygen and see if their oxygen levels maintain. So you can have oxygen sensors, and as you wake them up sort of slowly, and you see if their breathing function resolves on its own. If their levels fall, you have to put the breathing back in place.